Sally, how are you doing today?
I'm doing great, thank you.
I'm glad to see you came back in. Who'd you bring in with you?
I brought Travis.
Okay, this is your husband, correct?
Yes, ma'am.
Okay, nice to meet you. I'm Dr. Hall.
Travis?
Okay, so Ellie, did you get a chance to talk to your husband on yesterday about, the...
I did briefly. I don't think I did a very good job.
Okay. Well, I'm glad she was able to bring you in today because we're going to discuss a couple things. Great news is I can help you. A little bit of bad news is it might not be as fast as you want it to be because I know you're ready to get back out there on the soccer field. But we can definitely get you situated, so we're going to go over a couple things today. I see she let you see about this spine and see how it worked a little bit. Can I grab that back from you? Okay. So pretty much how this works is, Travis, your wife has a spine, just like you do. And on top of her spine sits her brain, and pretty much is the central, pretty much like the motor of a car. And down from the brain, she has a spinal cord. The spinal cord branches out. And along with the spinal cord, you have different regions of the spine. Up here, we call this the cervical region, often known to most people as the neck region. It controls a lot of the movement or just the controlling, like, motor part of the arm, so flexing and moving that around. And then you have the middle part, which is known as the thoracic. We call it the middle back for, most people. And it controls a lot of the major organs, so just how she's able to breathe and different things like that. And then the lower part of her back, which is the lumbar region, which is what she's actually complaining of having a little bit of trouble with, is the lumbar spine, and that's pretty much what we're going to look at. But we don't just stop there with the lumbar spine just because she's having issues with that. So when your wife came in, she did let me know that she's been training pretty hard, getting ready for this big soccer tournament that's coming up, and she's been having some lower back issues. And so what we were able to do was speak with a previous general practitioner that she had been seeing, was able to obtain those x-rays from that doctor and just to see if there was anything major going on. The great thing was there are no fractures, nothing major like that, but what we're thinking is going on is she's having some spasms and pretty much what we would like to call a malplacement of some bones in her lower part of her spine. So what happens is these bones, sometimes they get kind of turned a little bit out of the normal curvature. We're used to seeing what we like to see, the good curvature of the spine. And once it gets turned out of place, she starts to feel some of the pain that she's been complaining of. Now, the biggest thing is a lot of people think that the symptoms that they're experiencing just came like right on. She must have just, had a major injury. But the good thing and the bad thing is that it probably didn't come overnight. But the good thing about that is knowing that because it didn't come overnight, her body's able to adapt. So just as it adapted to the injury, it'll be able to adapt once we get her fixed up. Okay? And so along with this injury with her spine, it can also kind of refer to other places. So she can have some issues, which I know she said from time to time she may have some headaches, and you guys weren't sure if that was related, but it could be. The great thing about this is that I was able to sit down after going through all of her records and everything, and I was able to realize that even though she does have the subluxation, which I told you is the kind of torque of her spine, we're able to fix that. So I did develop a great treatment plan for you guys, something that I think is really feasible. We'll get her right back out there in the field like she needs to, be, and it won't take much time at all. So the good thing about that is we're ready to get you back on the field. The treatment plan entails getting you here 3 days a week, which I know you said you were, ready to do whatever it takes to get you back on the field. So we'll do 3 days a week, Monday, Wednesday, and Friday, which fit with your schedule. And we'll just do, a couple different exercises along with some of the modalities, and of course I'll adjust you as I always do.
Okay.
And so we're looking at doing this for 4 weeks, but what I want to do is just reevaluate you after 2 weeks just to see, how we're progressing. I do want you guys to understand that this is not an overnight process. It could take a little bit longer than expected, but we are pretty sure that we can get you back where you were, if not better. And along with that, there is, a fee associated with it. It's $50 per day, for those 3 days. So we're looking at about $150 a week. For the 4 weeks, we're looking at about $600. Is that something you guys think you could handle?
Yes, ma'am.
Okay. Well, what I need you to do along with getting her in here is make sure when she goes home, even when she's tired and doesn't feel like it, to make sure she does those exercises.
Okay.
And that she doesn't push her body too hard while she's waiting to heal, because I know she wants to get back out there on the field, but we want to make sure that she takes the proper time to heal, because she does move too fast, too quick. It could basically like set you back. Do you have any questions that you can think of at this time? Okay, so we'll go ahead and get that treatment started for you today. Since you guys are ready to get that started, I'll make sure to send a